Welcome back. In this video, we will go over the origin, insertion, and action of some of the shoulder, arm, and forearm muscles. Starting with the deltoid muscle, it is the prime mover of arm abduction. When you pull the arm away from the midline of the body, this is abduction. It also assists in flexion, extension, and rotation of the humerus, which is the bone in the arm. The origin of the deltoid muscle, which is the immovable attachment site, is the lateral third of the clavicle, the bone right here, and the acromion and the spine of the scapula posteriorly. Insertion, it is inserted in the deltoid tuberosity of the humerus. So on the shaft of the humerus, we find the deltoid tuberosity where the deltoid muscle is inserted. Moving to the triceps brachii muscle, triceps from three heads. Here we can see the lateral head, the long head, and also we have the medial head. The triceps brachii is a powerful forearm extensor. This is the arm right here, and that is the forearm. The origin for the long head is the inferior margin of the glenoid cavity. That's the long head. The glenoid cavity is a structure on the scapula. The origin of the lateral head is the posterior humerus, whereas the origin of the medial head is the distal radial groove on the posterior humerus. So the radial groove is a structure on the posterior aspect of the humerus, where the medial head originates from. Moving to the insertion of the triceps brachii muscle, it is inserted on the olecranon of the ulna. The olecranon process is a structure on the ulna. The ulna is the medial bone in the forearm. Moving to the biceps brachii muscle, right here we can see the biceps brachii muscle. The action, it is a powerful flexor of the elbow and a supinator of the forearm. So that is the arm, that is the elbow, and this is the forearm. Bi from two, it has two heads. They are covered with the pectoralis major muscle and the deltoid. The origin of the short head is the coracoid process, which is a structure on the scapula. The origin of the long head is the supraglenoid tubercle and the lip of the glenoid cavity. The glenoid cavity is a structure on the scapula. Also, the tendon of the long head runs in the intertubercular sulcus, also called the intertubercular groove, and within the capsule of the shoulder joint. The biceps brachii muscle, it is inserted on the radial tuberosity. The radial tuberosity is a structure on the radius, which is the lateral bone in the forearm. Based on that, it helps the biceps brachii to supinate the forearm. Moving to the brachialis muscle, this is the brachialis muscle. The action, it is a major flexor of the forearm. That is the forearm right here. The origin originates from the distal portion of the anterior humerus. It is inserted on the coronoid process of the ulna, which is the medial bone in the forearm. Moving to the flexor carpi radialis muscle, which is this right here, flexor. It is on the anterior aspect of the forearm. Carpals radialis, it runs laterally, which is toward the thumb. The action, it is a powerful flexor of the wrist, from the name flexor of the wrist. It also abducts the hand. The origin is the medial epicondyle of the humerus, which is the bone in your arm, the medial. Remember, that's the medial aspect of the upper extremity in the anatomical position. The insertion, it is inserted in the base of the metacarpals, the second and the third. Moving to the extensor digitorum muscle, extensor, it extends digitorum, the digits. This muscle is located on the posterior aspect of the forearm. Notice how it runs, the tendon runs over the wrist, and it is connected to the four fingers, except the thumb right here. Digitorum, the digital region, which are the fingers. Action, it is the prime mover of finger extension. It extends the wrist. It flare abduct the fingers. Moving to the origin, it originates from the lateral epicondyle of the humerus. In the anatomical position, this is the lateral aspect, which is toward the thumb, and this is the medial aspect of the forearm, which is toward the little finger. It is inserted by four tendons into the distal phalanges of the second through the fifth finger. Also, in the anatomical position, we start counting. That's number 1, 2, 3, and 4, and 5. So the thumb is the first finger in the anatomical position.